Shocking decisions made by King Charles due to his poor health will never be forgiven. But what decision did he have to make, and how will it affect us? Stay tuned until the end of the video to find out all the details and more. The king didn't want to disclose it and kept it secret. He suffered constant pain for months, and then he was diagnosed with an enlarged prostate in February. Although he has not recovered yet and is completely not out of danger, the doctors are encouraged about his health progress. But guess what? This progress seems to have been overtaken by the king as expected, and he started making some decisions that defied the doctor's advice. Now, this isn't even a joke. The cancer-stricken king is reportedly set to ignore medical advice and make the journey to Samoa for the Commonwealth Heads of Government meeting, CHOGM, on October 21st, despite his ongoing battle with cancer. Safe for the king or not, insiders claim that Prince William is unable to replace him due to the Princess of Wales' own health struggles, leaving no other working royal considered senior enough to take the king's place. The insider also revealed that attending the CHOGM is not something William can take on at this time due to Kate's health, and although Anne and other working royals are doing a great job stepping in to plug the gaps at home, they are not viewed as high-level enough to represent the sovereign as leader of the Commonwealth. So what do you think the king should do in this situation? However, it has been reported that palace aides have not yet visited Samoa to plan for the king and queen consort's trip, which was supposed to include a state visit to Australia. A source disclosed the importance of the visit in terms of securing Australia's commitment to the Commonwealth amidst increasing Republican sentiment. King Charles's presence at both the Commonwealth meeting and in Australia is viewed as instrumental in preserving Commonwealth unity. Despite medical advice recommending against traveling long distances, particularly due to the time difference, which can add to exhaustion, the king is just sticking to his decision to undertake the trip. Is this step worth taking, or is it just the monarch showing his stubbornness? What do you think about it? By the way, Charles was confirmed to attend the 27th Commonwealth Heads of Government meeting, CHOGM, prior to his cancer diagnosis. This would be the first under his leadership. Consisting of 56 member countries from across Africa, Asia, the Caribbean, and the Pacific, CHOGM will be hosted for the first time by a small island state, Samoa. The firm sees this meeting as crucial for keeping its influence over the Commonwealth, so that's why the king's presence is valued. The source said, "The king is determined to attend himself. It's not something that a stand-in can really undertake on his behalf." If you're enjoying the video, hit subscribe and turn on the notifications so you do not miss our future video on cringe and secret updates on the royal family. As of now, palace staff are re-evaluating the planned schedule and will soon begin initial preparations, which include visiting locations to get ready for a smaller tour. It means, luckily, the royal family is taking some precautions. So to save the king from exhaustion, the tour will be very much scaled down, and aides are also looking at holding events at times that fit more within the UK's time zone so that the king can remain strong and healthy during the visit. Australia is being viewed as a key part of the tour, because if that's lost, the rest of the Commonwealth will fall like dominoes. But here is a twist to the story that no one saw coming. The insider added that despite Prince William potentially being able to stand in for his father, it is highly unlikely he would do so. It was reported in December that Prince William has significant plans to modernize the monarchy upon succeeding his father. Yeah, so the future king is reportedly creating a 5-point plan to say goodbye to the beloved Commonwealth that was cherished by the late Queen and his father. So there is already a reluctance from both William and Kate to join the tour of the Commonwealth because they felt it was an outdated institution. Meanwhile, King Charles is determined to take the actions he deems necessary. His plans for a state trip to Ireland aimed at reconstituting Anglo-Irish relations are now in doubt due to his ongoing cancer treatment. According to a senior government source, the monarch is eager to visit the country, but it would take 4 to 6 months to prepare for such a trip. The trip would follow in the footsteps of Queen Elizabeth II and George V, who both previously visited while reigning as monarchs. London and Dublin are said to be keen on going ahead with the trip to help improve relations. However, one UK government source said, although the King and Queen Camilla definitely want to attend, it would take officials up to 6 months to organize. However, the King's health will undoubtedly play a significant role in this decision. Charles would be expected to attend several events in Dublin and other parts of Ireland during the trip, which would likely span several days. He was the first member of the British royal family to visit Ireland after it declared independence from Britain in 1919, back when he was the Prince of Wales. Historically speaking, Queen Elizabeth was the first British monarch to tour an independent Ireland in 2011. Her 4-day trip consisted of the late Queen making a personal speech in which she spoke Irish and visited Croke Park Stadium, where 14 people died in a slaughter by British forces. Now, there's an even more crucial context for the King's tour that you will find fascinating. The potential visit by the King aligns with the newly elected Labour government's efforts to mend relations with Ireland. This initiative follows remarks by Irish Prime Minister Simon Harris, who emphasized that the next generation will never forgive us if we don't seize this opportunity to reset Anglo-Irish relations. Despite there being clear policy differences and difficulties and challenges between the UK and Ireland since Brexit, Harris said he is keen to work alongside Prime Minister Sir Keir Starmer. The Taoiseach has been invited to Downing Street on July 17th by the Labour leader. Harris said that the British-Irish relationship remains robust, and he expressed his intention to explore ways to promise the commitments of the Good Friday Agreement. But again, King Charles's future plans have encountered a big roadblock due to a stern warning from his medical team. Despite his intentions to visit New Zealand, it appears unlikely that King Charles and Queen Camilla will be making the trip this year. What if these foreign visits become the catalyst for something we all fear? Because, following his diagnosis of prostate cancer, King Charles has been receiving weekly treatments. Despite resuming public duties in April, doctors have advised against lengthy stays, stating he is not well enough for extended travel. This raises concerns about the toll such trips might take on his health and well-being. A source shared with the outlet, "Naturally, it will be a bitter disappointment on both sides to not have the opportunity for the King and Queen to visit New Zealand. But, of course, all are aware of the King's ongoing health and the need for him to pace himself. It's very much hoped there will be further opportunities in the future." The last royal tour down under was in 2018, when Prince Harry and Meghan Markle visited to celebrate the Commonwealth Games. Sources indicate that the Australia leg of the tour will be scaled back to accommodate the King's recovery. Should the visit proceed, the King might stay in Australia for 6 days and travel to Samoa for 3 days with a 2-day gap. Buckingham Palace has not yet confirmed the travel details of the official tour, but most likely it will happen. Can you imagine the determination and resilience required? The monarch has expressed his determination to overcome his cancer diagnosis, as revealed in heartfelt letters to friends. Despite his illness, the 75-year-old monarch remains optimistic and focused on recovery. He resumed public duties, accompanied by Queen Camilla, during a visit to London's Macmillan Cancer Centre, where he interacted with patients. In a touching exchange, King Charles told chemotherapy patient Leslie Woodbridge, "I've got to have my treatment this afternoon as well." When asked about his health, he reassured another patient saying, "I'm all right, thank you very much. Not too bad." Letters shared with the Times highlight the King's unshatterable determination to conquer the disease. Despite describing his somewhat battered health, friends noted the letters were full of light. One recipient mentioned Charles's determination to fight through his illness, while another remarked on his optimistic tone, filled with exclamation marks. King Charles, known for his preference for letter writing over using a mobile phone, has been described by friends as a caged lion. Frustrated by his diagnosis, yet eager to continue his work and achieve more. Prince William is reportedly concerned for his father's health, wanting to ensure that he balances his recovery with his responsibilities. A source close to the prince said, "He wants to make sure his father is balancing his recovery. He knows his dad loves work, but he does worry about him." The King, even at the age of 75 and diagnosed with cancer, is fully determined to perform his duties. So he extended heartfelt thanks to Prince William for stepping up to royal duties on the same day as England's Euro semi-final match. On Thursday, the King attended an event at the Senedd to celebrate its 25th anniversary. Prince William visited Anglesey earlier in the week to revisit the RAF Valley, which was quite tiring. Consequently, he was unable to travel to Germany for the England versus Netherlands match on Wednesday. Knowing how passionate Prince William is about football, it was significant that he prioritized royal duties over attending the game, at King Charles's request. What a commitment to work by dad and son. Share your thoughts about King Charles's health trouble in the comments below. Don't forget to subscribe for the latest updates on the Royals family and their growing problems. See you in the next video.